Hello, my name is Eric Bricker, and I'm the Chief Medical Officer of Compass Professional Health Services. Compass is a healthcare consumer advocacy firm that provides tools and support to healthcare consumers. Compass supports about 1,100 employer clients across the country, and as the Chief Medical Officer, I'm a general internist primary care physician. I do a lot of the training and education for our broker, benefit consultant, and employer clients. And so today I want to talk about three topics in regards to health reform. And health reform is obviously on everyone's mind. And so those three topics regarding health reform are actuarial value, a minimum value plan, and also the percent of employee contribution to the premium. And those three things are important because sort of achieving those three areas or addressing those three areas can allow a health plan to achieve what's called safe harbor, which means that the plan will be in compliant with the Department of Health and Human Services guidelines, and so then will not need to then pay out a penalty or a fine, if you will. And so in regards to that first issue of actuarial value is the percent that the plan or the insurance carrier would pay out in regards to expenses, i.e. covering the cost of a hospitalization or ER visit or prescriptions, and that actuarial value then ties into the minimum value of a plan. And so the minimum value of a plan is sort of that bronze plan that some folks may be familiar with, and that's where the actuarial value of a minimum plan needs to be at least 60%. And so to give you an idea of what those types of plans might look like in terms of plan design, sort of a 70% actuarial plan would have an individual deductible of about $1,500 with coinsurance after that to an out-of-pocket max of around $5,000 or $5,500. That's just for an individual. And so that would then fall within sort of the guidelines of a bronze plan, if you will. And then certainly you can have 70, 80, 90% actuarial value plans that are sort of those silver and gold value plans. So you can almost think of actuarial value as the sort of converse of what the employee or the member out-of-pocket cost would be. So if it has a 60% actuarial value plan, that means that the employee would be paying 40% of the costs. And then so the third or the final point to then talk about is in regards to the maximum employee contribution to the premium. And so that has been set at 9.5% of the employee's W-2 income. And so that's an important distinction because initially they were looking at, they being the Department of Health and Human Services and the IRS, were looking to have it be overall household income, but then it was going to be very difficult for employers to capture, spouse, income from other members of the family. So they decided it would just be the employee's W-2 income, which can be found on box 1 of their W-2. And so the employee's premium contribution cannot be in excess of 9.5% of that income. And so if you had an employee making $40,000 a year, it would be a little less than $4,000 is what the employee's premium contribution could be over the course of the year. And so by achieving a minimum value plan and having an employee premium contribution that is less than or equal to 9.5% of their W-2 income, then the employer and their plan will have achieved quote-unquote safe harbor. So they will not be susceptible to those fines or penalties from the Department of Health and Human Services and the IRS, okay? So what does that have to do then with price transparency and consumerism is that within those health reform guidelines, there's still quite a bit of potential for employee out-of-pocket cost or employee cost share in the plan. And so as employers and employees going forward in 2014 and in subsequent years are thinking about how to design their plan and how to structure their plan in terms of providing the most value and high quality care in a way that's cost effective, I believe that really consumerism, consumer-directed health plans, and price transparency will really be a key part to that future. Again, because there's a lot of at stake in terms of not only the cost for the plan, but also the out-of-pocket cost for the employees. And so as you, as an employer or a broker benefit consultant, are considering health reform in 2013 in preparation for the coming years, I believe it will be important to position yourselves and your clients and your employees in regards to actuarial value, the minimum value of the plan, and the percent employee premium contribution. So with that, thank you so much for watching. If you'd like to learn more about health reform and how consumerism and price transparency relate to that, then there is a link at the end of this video where you can learn more as well. Thank you so much.